Okay, we're away.
Lovely. Okay, well, good evening, everybody. Lovely. Thank you, Freddie, for hosting this and getting things moving. And it's my great pleasure to welcome you all to the College of Medicine. For those of you who don't know me, I'm Mark Chambers. I'm a retired GP. On behalf of myself and my colleagues this evening, Dr. Naveed Akhtar and Freddie Jacquin, I'd like to start by thanking Amanda King and the College of Medicine for inviting us here this evening. Many of you will probably be aware that the College of Medicine is celebrating its 10th birthday at the moment, and marking this with the launching of a new manifesto this month. And as part of this, the college is reviving the idea of offering a monthly teaching session on the first Thursday of each month, and we've got the honour of being the first up for this. We also have the extra honour this evening of having the Chair of College, Dr. Michael Dixon, with us this evening. So a particular welcome to Michael, and thank you for being here. One of the things that Naveed, Freddie and I have in common is that we all use hypnosis in our professional practices. And we're preparing a series of sessions, of which this is the first, in which we aim to demystify hypnosis and to demonstrate that a lot of what we do with our patients and clients that is particularly effective is a function simply of what and how we communicate. So we're looking at these as a series of advanced communication workshops, if you like. Naveed and Freddie will introduce themselves shortly. Suffice it for me to say that Naveed is one of the next generation of GPs who is continuing this pioneering work of the college in integrating all these different systems of healthcare. And Freddie is a well-known to pretty much all of you, I suspect, is a world-respected, amazing practitioner and teacher. And it's a real honour for me to be sharing a teaching platform with both of these people. My background for this is that I retired 3 years ago from general practice after 35 years as a GP and a GP trainer. And since then, I've been practicing and teaching mindfulness, clinical hypnosis and generative coaching, as well as this work with the College of Medicine, currently setting up the Faculty of Mind-Body Medicine. And this is a forum where people of all backgrounds can meet and learn from each other about the many different ways people can be helped, in addition to the conventional Western medicine that I trained in and practiced for so many years. We have much to learn from each other, and none of us knows as much as all of us. So it's a real pleasure to welcome people from all sorts of different backgrounds here. My interest in exploring hypnosis in particular and complementary techniques generally was stimulated when I was a medical student by a particularly enlightened consultant psychiatrist who brought my attention to the work of Dr. Milton Erickson, who is an American consultant psychiatrist. Erickson died in 1980, just when I was a medical student, and his obituary was in the BMJ at that time. Erickson was something of a maverick and rather controversially at the time used hypnosis with a number of his patients. I started working in general practice in 1982 and quickly realized that for many patients consulting me, the pills, the potions and medications that my traditional Western medical training had equipped me with were just not enough for the job. Many of these people were not broken and didn't need fixing. Their needs were much more educational than therapeutic. Then added to this a constraint of having only 10 minutes with each patient and often less. The average patient bringing 3 problems to a consultation, this presented a considerable challenge. And I don't think very much has changed really in the 40 years that I've been as part of the medical fraternity. The word doctor comes from the Latin verb docere, which means to teach. In his teaching, Erickson shifted the paradigm from a therapeutic to an educational one. He coined the term clinical hypnosis, which he defined as being what to do when you don't know what to do. And as a GP, I commonly found myself in this predicament throughout my medical career. Patients sent back to the care of their GP when traditional conventional medical therapies had been thoroughly explored. Erickson's definition of hypnosis is the elicitation and utilization of unconscious learning to meet the needs, values, competencies and interests of the present self. And this echoes the father of Western medicine, Hippocrates, who said it's natural forces within us that are the true healers of disease. And our job as caring professionals in all walks is to put our patients and clients in touch with these inner resources. Hippocrates also taught about the importance of the therapeutic relationship. And Erickson described our job as being like the weather. We create the climate where change and transformation can occur. The patient provides the content and we provide the process. There's a strong evidence base to support this now, particularly in psychotherapy, where pretty much all techniques are found to be equally effective. And what generates the best outcomes is the quality of the rapport and the expectation developed between clinician and patient. Michael Balint coined the term the drug doctor to describe this. So what we're intending to look at in this and subsequent sessions is how we can use ourselves, and particularly our communication skills, to best help our patients. This is particularly relevant when the pills, potions and preparations that have been explored and the evidence base perhaps exhausted. In these circumstances, we still have a duty of care to our patients, and I would suggest an obligation to keep an honest candle of hope aflame as best we can. And we know from modern studies of neuroplasticity that people learn best when their attention is focused, and particularly when they're doing things. So we aim to make these sessions as experiential as possible, learning by doing. Telling is not teaching, so I'll be shutting up very shortly. Tonight, Freddie will have you doing stuff so that you can take away new skill sets to work with yourself from these sessions. So please do participate to get the most out of this. We also know that novelty and emotional arousal help learning, so things may well feel challenging and a bit strange, and this is good. It means that you are learning. Humor helps too, so do what you do seriously, always with great humor. And finally, there's no substitute for practice, so I encourage you all to take from tonight and any subsequent sessions whatever works for you, and keep practicing it over and over right away until it becomes yours. For a hand over, we'll welcome all feedback. We've got a series of topics that we're thinking of presenting, and we would very much like participants to feedback either in the chat box or directly to us, whatever ways they wish, so that we can gear what we do in future to people's needs. So well, thank you for listening to me, and I'll hand on now to Naveed for introduce himself and his work, and then Freddie will take over from there. So thank you.
Can you hear me?
Yeah.
Excellent. Well, good evening, everyone. It's so good to see so many of you here this evening with us today, and welcome to the first of a series of 1-hour monthly seminars by the College of Medicine, with the focus on specific medical conditions and how you can use the power of your communication to help your patients quickly and more effectively. Now, the topic of tonight's seminar is chronic pain, but as Mark has already mentioned, we aim to cover a wide range of topics during our series, including chronic fatigue, irritable bowel, panic attacks, sleep problems, anxiety and stress, to name a few. So please make sure that you can join us for those as well. We urge you to sign up as members of the College of Medicine if you haven't done so already, so you can continue to receive updates of all the upcoming learning events. Mark has very kindly introduced me. My name is Naveed Akhtar, and I've been a GP partner for over 12 years. I'm the Vice Chairman of the Integrated Medical Alliance and the co-founder of the Integrative Health Convention, which is the UK's largest integrative health conference for doctors, therapists, all health professionals and the public, where we bring together experts from all over the world under one roof to discuss different aspects of conventional and complementary therapies, as well as self-care modalities. We're looking forward to the 2021 convention, which we're planning to run virtually and will be the largest that we've ever held. And we'd love for all of you to join us. Now, the format of these seminars has been designed to be experiential. We want to get every one of you involved in these seminars. It's not just about sitting there and listening to what we have to say. We want you to practice what we teach so you can start applying these techniques from tomorrow on your family, your friends, your patients, and your clients. Now, often we get asked lots of questions, and one of them is, am I allowed to do this? Or do I need a qualification to do this? Well, everything that we're teaching you here today and across these series of seminars is conversational. You are doing no more than just saying the right thing in the right way to have the maximum impact with your patient. Now, there's no magic involved, there's no witchcraft. It's simply using your vocabulary in a more effective way. In fact, we've made it super easy for you by giving you the words. All of you should have received the script, and all you need to do is read this out and see what results you get. Now, the other question we get is, can it really be this easy? And my answer, it's always yes. It can actually be this easy. Now, I'm not just saying this. Dr. Chambers has been doing this for over 30 years, and I've been practicing these techniques for over 10. And we've been both teaching doctors and other medical professionals these techniques for many, many years. And we're still astounded at the results that we and our students report. Now, one thing to understand about patients and clients is that when they approach you for help, they're already in a heightened and highly suggestible state. And it's very easy to help them by saying the right thing, or it's easy to ruin the interaction by saying the wrong thing. Let me give you a very simple example. I'm going to say a phrase that I absolutely hate, but I guarantee it's a phrase that most of you have either said it to a patient, or if you've been a patient, then someone might have said this to you. Now, how many of you have heard the phrase sharp scratch? I can see a few nodding your heads. Well, think about what message you're conveying to a patient when this is said. Sharp scratch. What you're actually saying is, I'm about to do something and it's going to hurt. Now, what if you changed what you say? Now, I often use the phrase, you might feel a tingle for a second or two and then you'll feel nothing. And then you just carry on talking about something completely unrelated. Now, let me ask you, was that easy to do? Now, do you think you need a qualification or a certificate to be able to say the same thing in a different way? Of course not. But I guarantee that if you say it in the right way, 9 times out of 10, your patient will hardly feel a thing. Now, in the time that you have with your patient, who wouldn't want to make the best use of that time to get a positive change in your patient as quickly as possible? And of all the health professionals out there, I think I'm right in saying that GPs have the least amount of time to work with, typically having only 10 minutes per appointment. Now, these techniques were developed with the time-poor professional in mind. And yes, it's possible to make a dramatic change in patients in less than 10 minutes. And for those of you who have the luxury of 1-hour sessions with your clients, imagine what you could do with the remainder of your 50 minutes once you've sorted out your client in the first 10. Now, I'm going to ask you to do just one thing, and that's to leave that skeptical, analytical, critical mind outside of the room just for the next hour or so. And I want you to come at this with an open mind, be focused, engaged, and let's all have fun with this. Now, I'm sure you want to get on with the fun stuff, so let's not keep you guys waiting any longer. So allow me to introduce Freddie, someone who doesn't really need an introduction. For those of you who've been following the College of Medicine during lockdown, you all know that he's been giving regular seminars to help us get through the stresses and strains that we've all been going through with this pandemic. Freddie is an internationally renowned hypnotherapist and a trainer and has run courses all over the world. So without any further ado, Freddie, it's over to you.
But thanks everyone for showing up tonight and being here and making the effort to come out. And thanks again to Amanda and for organising this, and Michael Dixon, who's the chair of the college, for letting us all organise and getting together, making these changes. As Naveed said, I'm a hypnotherapist. That's it. I'm a hypnotist, I'm a hypnotherapist. I only have words. You know, I'm not a scientist, I'm not a doctor, I can't prescribe, and all I have is words. And to be honest with you, that's all we all have. And our brain is never silent. It's always chattering away. But what we say to ourselves and what we are thinking makes a massive difference to the way we feel. We're going to be talking about chronic pain this evening. I'm going to show you a way of overcoming chronic pain within minutes. I can see there are some people here that I've worked with in the past who have had that experience. And you will, if you've got any discomfort this evening, I fully expect, because I'm going to demonstrate this with you all first, and then we're going to, if you want, you can try this with each other. But I want you to go away this evening with this ability. And it's not complex. And as Dr. Naveed was saying, we, as GPs, you don't have a lot of time. And I think that's been the kind of sticking point for most doctors when they come to talking about hypnosis. I don't have the time just to do a long-winded induction, you know, relaxing people for half an hour. You just don't have the time. But what if in that 5 or 10 minutes, just in conversation, you could quite literally change someone's mind about the way they feel to eliminate anxiety or stress in that period of time. And when you're giving your patient maximum amount of medication that you can give them, and it's no longer touching that problem, I would suggest that using your words and using their imagination, if you like, is something you can do. And you can do it without even using the word hypnosis, because for me, hypnosis is just an advanced, heightened learning state. The word itself has connotations because of the stage stuff, and people talk about hypnosis in that way. But I think over these last few years, maybe 10, 20 years, we're getting away from those ideas. We know, because it's out there and it's been out there long enough to know that there's real value in hypnosis or trance, whichever way you want to call it. So for me now, it's very simple. And as Dr. Naveed was saying, any kind of heightened emotional state is an opportunity to give someone a suggestion that will bypass what's known as the critical faculty, that part of us that goes, no, I'm not listening. And this is how I see the critical faculty. If you've only done hypnosis or therapy, you'll have heard those terms. And it's a bit like the mind, it's a bit like the spirit. You know, we use these words, but it's an intangible part of our being. But I see the critical faculty as a kind of defense mechanism. As a child, if we're told that Santa Claus exists, then we just believe it. If we're told fairy stories, we believe that they're true because we don't have that defense. But as we grow up, maybe 16, 17, this defense mechanism is formed, which protects us, if you like, against flattery, sales, lies, untruths. It gives us that protection against those things, which as a child you don't have. And so there's that resistance to any kind of suggestion. We kind of figure it out first. But what I believe hypnosis does, and not hypnosis, but an emotional spike. For a moment, if you look at this critical faculty like a fine mesh across your brain, which is protecting you, when you spike an emotion, it kind of goes like this, opens up for a moment, and it's open to suggestions. It's open to more learning. So it's a rapid way of learning something. I'm going to show you what I mean by this in a moment, so you understand. Because for me now, hypnotizing or influencing, whichever way you want to put it, is very simple. If I can create an emotion within you, then I can give you a suggestions like this stick. So I'm going to ask you all to do this and just have the experience, okay? And do this for me, all of you. Just you can put your right arm or left arm out in front of you, about shoulder height. Okay? And I want you to just look at me in the camera. And as you do that, I want you to think about the people you love, whether that's your child, your mother, your brother, your sister, your partner, your friend, but feel that love right now. It could be a pet, but feel that love right now. See that face, feel that love. And as you feel that love, as you see those faces, I want you to notice the arms hanging all by itself. Imagine now there's nothing you can do about that. And when you realize there's nothing you can do about it, I want you to try and get it down and find you cannot. But I don't want you to pretend. Push even harder, find it goes even higher. Put some effort in and find it goes even higher now. But are you hypnotized? Are you in a trance? Why can't you get your arm down? Is that even your arm? At this point in time, if I suggested we could operate on an arm, we could operate on an arm, you wouldn't feel anything. Push even harder, find it goes even higher. Do not pretend. But are you hypnotized? Are you in a trance? Are your eyes closed? Are you relaxed? No. I'm going to click my fingers and your arm will drift down and your eyes will close for a split second. When I open, you have a new understanding about the power of your mind. Now, where's the hypnosis? Where's the relax, relax, relax? Where's the deeper, deeper down? Where's any of the things that we normally associate with hypnosis? But for a lot of you, you had the experience within a minute. You can go down now, Annie. That's all right. You can put your arm down now. You had the experience of what I call a happening. You know, people say, what's the difference between a normal suggestion and a hypnotic suggestion? Because we hear that term all the time. It's a hypnotic suggestion. What's the difference between that and should we have a cup of tea? What's the difference between a hypnotic suggestion and just a normal suggestion? The difference is that this is just a Freddyism, if you like, a Freddy theory for what it's worth. I believe that hypnotic suggestions turn a doing into a happening. If I say to you, can you lift your arm up? And you lift your arm up, you are doing that. There's a feeling that you are taking part in that. But if I suggest to you that in a moment your hand's going to start to feel lighter and it's going to start to drift up by itself, and then you experience that happening, you're going to experience it as a happening. And so let's just get to the next part of this. If you're in therapy or if you're a doctor of any kind, your client is experiencing their problem as a happening. I'm anxious. They're not doing that. I don't think they're doing that. Their experience as a happening. You know, I'm anxious, I'm stressed, I'm in pain. It's a happening. And so if you want to look at it a different way, they're in a kind of state of trance. I can't stop doing this trance, if you like. I can't stop feeling afraid trance. But either way, at some point, and if you think about any of your strong memories in your life, can be anything. Think about a really strong memory in your life, and there'll be a big emotional attachment to it. There'll be something attached to that. And so that's happening all the time in our life. So as therapists, as GPs, as doctors, as people who are working with people who are not well or in pain, once you understand this small piece of information, you can change someone's life in moments or minutes. And I'm going to give you a technique for doing that. And it's a technique that I developed. So it takes minutes, not hours to do. And people have asked me how this works. And I'm not a scientist, I'm not a doctor, and I have no idea how it works, okay? I'd love to know, and hopefully at some point they'll do enough research into how this works to find out. But the truth of the matter is, my clients and your clients don't really care. They want to be out of their fear, they want to be out of their pain, they want to be out of their whatever they're suffering. And they may be interested, and I'm sure they will be, when you run this with them and they come in chronic pain and 5 minutes later they haven't got that pain. They're going to want to know how, and maybe they can look into it. But this is my theory, a Freddie theory for what it's worth. We all know that under certain circumstances, we feel no pain. We know this from battle situations where people suffer immense injuries and carry on fighting or carry on moving. You know, if someone was to come up to you in the street and just slapped you hard in the face, it would disable you for a little while. And yet you get people in these situations where they can lose a limb, they can lose part of their hand or whatever it is and carry on moving. Because the reason for that is their life is under immediate threat. If your life is under immediate threat, you will not feel any pain. I often have people come and see me, and especially if they're young mums, and they say, I'm in this pain and I can't get rid of it, and it's blah, blah, blah. And I say, well, if your child was about to step into the street in front of traffic, where would your pain be? And they say, I wouldn't feel any pain. In that moment, the brain would shut it off. And it does that. I think it was Mark who was talking about the great Milton Erickson. And there's a story from Milton Erickson's life where he went to see a patient. I think he was suffering from cancer of the jaw. So the man only had a few months left to live, and the guy was in agony. But he didn't want any more medication because he wanted to be able to converse with his family for the last few months of his life. No, it was a woman. It wasn't a man, it was a woman. So as a last resort, they called Erickson in. This woman's in a hospital room. She's in agony. And he just said these words to her. He said, if a Bengal tiger burst through that door, where would your pain be? And she said, I wouldn't have any pain. In that moment, she knew there was a space she could get to where she could switch it off. And we all have that. We all have the ability. And this, again, is just my theory. But I believe your unconscious mind, your subconscious mind, the instinctive part of who you are, is always working for you to thrive. It wants you to thrive. Given the opportunity, it will make you'll go from illness to well-being. You'll go from sadness to happiness. You'll go from wherever you are to thriving. It just needs the right direction. And given the right direction, it will say, and you're going to experience it in a while, we can ignore this pain if the pain is useless and unnecessary. And I'm going to get that in now. You'll see when we do this technique in a moment, the first thing I ask my client is that pain of any use to you? And by that, I mean, is it long-term chronic pain? If a client comes to see you, and if you're not a doctor, you are just a lay therapist like I am, and the patient says, I've had this headache for 2 weeks, can you help me with it? I am not going to say, yes, I can, unless I say, have you been to see your doctor first? If they've been to their medical doctor and the medical doctor is saying this is long-term, they're just giving you painkillers and nothing else, then I would suggest you run these techniques with them. And we know there's an opiate epidemic on the planet. We know there are people, I think I read a statistic last year in America, 47,000 people died from accidental opiate overdoses. Just accidental, never mind what they're taking anyway. And so we know there's a massive problem. And if you're giving your client or your patient as much medication as you can, it's no longer touching that pain, I'm going to suggest you run this technique with them. And I know for a lot of you, it's a step out of your comfort zone to say to your patient, look, let's try this. It's just about using your imagination for a moment. So I'm going to stop talking about this. I'm going to run it with you now, and then we're going to go over it again, the actual steps, so that you can do this for yourself, okay? And you can do this for yourself, as I just said. You can run this as like a self-hypnosis technique or a self-talk technique. So if you are in pain, if you're suffering, and that pain can be deemed any kind of pain. So whether it's physical, emotional, whether you call that pain anxiety, whether you call that pain stress or grief or sadness, you can use the same technique to deal with all of those things. So we're going to show you how to do this now. And I want you all, that if you are in any kind of discomfort, and I want you to do this for me. I want you to just for a moment, just focus on that pain or discomfort. And on a scale of 1 to 10, 10 being excruciating and 0 being no pain at all, I want you to put that number in the chat box for me. So whether it's discomfort, whether it's anxiety, whether it's any kind of thing that you could deem to be pain of some kind or discomfort, put the number in the chat box. Great. And keep going. As I said, don't focus on it. I just want you to just look at it for a moment and then put that number in the chat box. Great. Because in a moment, if that pain is useless, unnecessary, and you've decided you can be free of it, then you're going to be free of that pain in a few moments. And that's a big statement. But I want you to understand this can happen online with 90 people. So you don't have to limit yourself to one person at a time. And I would suggest that you do this. For the last 2 or 3 years, every first Sunday of the month, I've been running free pain webinars like this. And I now know that thousands of people who were in pain are not in pain anymore. And I've done no more than I'm going to do right now with you. Okay. So I'm going to ask this question again. You're going to ask your client or your patient the same question. And if you're a doctor, you won't have to ask the question because you'll know it. But is that pain of any use to you? Is there any benefit in that pain? Let me ask it another way. And I want you to ask it this way as well. In a moment from now, when the pain is gone completely, will it be detrimental to you in any way? And if the answer to that is no, then we're going to get into this, okay? So I want you all to do this. And you can do this eyes open, eyes closed. I want you to just take a breath in. Take a breath in. And I want you to do this. You can do this. If it's better for you to have your eyes closed, that's fine. I want you to just imagine drifting up out of your body. The essence of who you are. That intangible part of your being, the passenger, the observer within that human form. I want you just to imagine drifting up out of your body. And I want you to imagine drifting higher and higher. Imagine like a helium balloon that some young child has let go in the park. Imagine you're drifting so high that you can look down and below you, you can see a massive target, like an archery target. You can maybe be able to see the coloured bands, you may be able to see the very centre, the bullseye. And as you picture that in your mind's eye, however you want to picture it is good enough. In the centre of that target is every ounce of the useless, unnecessary pain and discomfort that you were experiencing. Now, in a moment, I'm going to make this sound. As I make that sound, you're going to be fired, shot like an arrow, straight through the centre of that target and straight out the other side into a space of bliss in a millisecond. But I want you to be brave about this, because as you go through the centre of that target, you may experience that pain even more intensely for a split second. But be brave. This is the last time it's going to affect you. So get ready. As I make that sound, you're going to be fired, shot like an arrow, straight through the centre of the target, straight out the other side in a millisecond. Get ready. And now you're out the other side, just drifting in that space. Just for a moment, see the faces of the people you love, people that love you. Feel that love now. Feel it like a burning hot sun in a summer sky. Shrink it down to a white hot nuclear powered ball of light. Pull it into the very core of your being, into your very heart center. Feel it flooding your body. And notice as you do that, that every ounce of pain is dissipated from your body. Now in your mind's eye, drift across the other side of the room so you can see yourself in that chair. You can see the clothes you're wearing. You can hear my voice. And notice as you watch yourself on the other side of the room, how every ounce of that useless, unnecessary pain has gone from your body and your mind. You cannot feel it. You cannot experience it. I'd like your unconscious, instinctive mind to make the changes now at a molecular, cellular, neurological level that will allow you that freedom forever. And only when the unconscious mind knows and has made the changes, only then will you drift back over to your body, drop down into your body in that chair. Only then will your eyes be able to open and you, with a smile on your face, unable to experience any of the useless, unnecessary pain. Go ahead, take your time, do it thoroughly. Only as quickly as those changes have taken place at a molecular level that will allow you that freedom from every ounce of useless, unnecessary pain. Emotional and physical, only then when you drift back over to your body, drop down into your body in that chair, only then with your eyes open, you with a smile on your face, unable to experience any of that useless pain. Go ahead, take your time, do it thoroughly, while I wait quietly for your return. Okay, excellent. Where's the pain gone now? Try and find it and find you cannot. On a scale of 1 to 10, where's the pain gone now? Put it in the chat box. Try and find it and find you cannot. That's right. On a scale of 1 to 10, where's the pain gone now? Exactly. I hope you can see those numbers. You know, I don't know how long that is. We can look at the recording, but I doubt it's more than 3 or 4 minutes. Why does this work? How does it work? I'm sure at some point there'll be people studying this and find out for us. In the meantime, you can be using this with your clients and your patients and people you love. You know, and yes, we always want this to go to a 0, and there are a load of zeros in that chat box right now. But the truth of the matter is, if someone's been in chronic pain and that pain's at 8 and 9 or 10, and it goes down to a 2 or a 3, that is miraculous for them. I'm sure you're feeling it now, those who've just been through that. It's an amazing thing. Without any pills, without any potions. And it's not long-winded. It doesn't take hours. It doesn't take weeks to overcome this. And people say, well, perhaps it's in this situation and perhaps it will come back. I've been doing this for many years now. And there are people out there, once the pain's gone, it's gone. And we are going to be speaking in future lectures about things like fibromyalgia. But you can use this with fibromyalgia. There is no reason why you should say to your patient, let's try this. With nothing to lose. You don't have to cloak it in the words hypnosis. You know, at no point did I say to you, relax, 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 deeper, deeper down. I didn't get my watch out, which I do have just to scare people down a pub, but I didn't use it tonight. You know, you don't have to do all that stuff. You know, this course is advanced communications, and that's what this is. It's communicating at a different level. Your patient, your client is already in an altered state when they enter your room. They are not in their normal state they walk into their greengrocers in. If you're a dentist, if you're a doctor, if any of those situations, your client's already in an altered state. You can spike an emotion like I did with all of you just by asking you, who do you love? You're going to access that feeling. And when you access that feeling, if my next utterance is, and you can relax while you have this injection, you're going to relax. Or nothing that happens here bothers or affects you. And I would suggest if you're giving injections or vaccinations, that's the suggestion. Take a breath in just for a moment. Think about, who do you love? Just ask the question in conversation. Who are the most important people in your life? They're going to access that emotion. And in your next utterance would be, well, nothing that happens here is going to bother or affect you or disturb you. And that is exactly what will happen now. This isn't hard to learn. These aren't scripts that you have to learn that take months to learn. I'm going to go over this technique again. in the simple steps. And I'm going to ask you, those of you who've got the notes, you've already got the notes there, but we will, because we've got the emails for everyone who registered, we will send you the kind of the script, for want of a better word, but it's really bullet points, because this is not a long-winded script. It's very simple. So you ask your client if the pain is useless and unnecessary. And I ask it in this way. That's the first time I ask it. Is that pain useless and unnecessary? Have you been to your doctor and had that pain checked out? And is there anything they're doing for it other than giving you painkillers? And if they say no, I'm still going to ask it in this way, because this is a suggestion, okay? And everything you're saying to your client and your patient is a suggestion. The moment they walk through your door, whether you think you're hypnotizing people, whether you think you're a hypnotist or not, you already are a hypnotist. You're already suggesting. So this next utterance is this. Let me ask it in a different way, I say. In a moment from now, when the pain's gone completely, will it be detrimental to you in any way? Understand how I'm saying these words. I say it in the same way as I say tomorrow, the sun will come up. It's not in a moment, if we're lucky, with the wind behind us, with a bit of luck, maybe with a bit of magic, we might be free of the pain. No. In a moment when the pain's gone, will it be detrimental to you in any way? I'm already suggesting it's already gone. So that's your first utterance. If they say no, so I'm going to ask you just to use your imagination for a moment. Do your best to imagine what I'm asking and see what happens. In a moment from now, you will not be able to feel that pain. And people say to me, well, I can't say that to my client or my patient, because what if they still feel the pain? And some of you went down to a 1 or a 2. And you can say, well, that wasn't true then. They still did feel some discomfort. My attitude, and it might be different because I'm not a doctor, my attitude is I am going to say it in that way, because if I act as if it's going to happen, and there's no doubt in my mind, I'm going to get better results for more people than if I don't act in that way. So everything I do, I'm going to act as if this is absolutely going to happen. So they don't feel anything from me other than my expectation that this is going to happen. So you ask the question, is it useless or unnecessary? In a moment from now, when that pain's gone, will it be detrimental to you anyway? On a scale of 1 to 10, and you want to do this, you need to do this. There's 2 things I symptom scale. One's pain, one's fear. And the reason I symptom scale those 2 things is because we can remember being in pain, but we can't remember what it felt like. I always say that's why women have more than one child. If they remember what the pain was like, they go, no, I'm stopping here, thanks. But, because you think, yeah, that was painful, but you can't remember what the pain felt like. It's the same with fear. We can remember being afraid of something, but when that fear's gone, it's hard to remember what it felt like. So you say on a scale of 1 to 10, and we're going to ask it in this way, and it's a little bit sneaky, I'll grant that. On a scale of 1 to 10, how bad is that pain now, right? We're going to ramp that up. On a scale of 1 to 10, how bad is that pain now? They're going to give you a number. And then you say this. In a moment, you won't be able to feel it. And I know that's going to be hard for some of you to say. But I would suggest you just say it as if it's going to happen. In a moment, you won't feel it. Tomorrow, the sun will come up. Do you understand my tone of voice here? It doesn't change. I'm going to ask you to imagine some things. Do your best to imagine. You do this eyes open, eyes closed. Most people are going to close their eyes. And here is the absolute technique, okay? I want you to imagine drifting up out of your body, leaving your body in that chair for a while. I sometimes say, we hear about these near-death experiences in hospital where someone said, I drifted up to the ceiling, I could see myself in the bed. Imagine you're just drifting up out of your body and leaving your body in that chair. Imagine you're drifting higher and higher. Imagine you're drifting so high that you can look down and in your mind's eye, you can see a target. Like an archery target, not an archery target. This is what we call being artfully vague. When we're going to paint a picture for our client, we don't want to make it an absolute picture. We want them to fill in the colors. So we say, like an archery target. They can see how they like then. You can see the colored bands, not the blue and white bands, because that might not be what they're seeing. So you've got to be artfully vague. All we're doing is sketching, if you like, this target. In your mind's eye, see a target like an archery target. You can see the coloured bands, you can see the very centre, the bullseye. And depending on what country you're in, perhaps not use the word bullseye. I use that in Brazil and it means something completely different in Brazil. So you could say the centre of the target, all right? But see the centre of the target. Now in the centre of the target, and listen to my words again here, in the centre of the target is the useless, unnecessary pain that you were experiencing. I've already put that pain in the past. Do you understand? It's very subtle and you would have missed it. In the center of that target is the useless, unnecessary, every ounce of the useless, unnecessary pain that you were experiencing. Have you got that? And in a moment, I'm going to make this sound. As I make that sound, you'll be fired, shot like an arrow, straight through the center of the target and straight out the other side in a millisecond. Now, one of my good friends, Bob Burns, who's a hypnotherapist, he did this technique, but he's a bit of a lad. He comes from Scotland, and he, instead of going, whoosh, he does this. Don't make it painful. This is instant, okay? Whoosh, straight out the other side. And then you say these words, which is very, people ask me why I do this. I'm going to say the words and you'll understand. As you go through the target, you may experience that pain. Not you will. You may experience that pain even more intensely for a split second. And people say, why would you make your client suffer even for a split second? And the only reason I use these words is to get this next suggestion in. And it's a very direct suggestion. In a moment, you're going to go through that target. You may experience that pain even more intensely for a split second. Be brave. Here comes the suggestion. This is the last time it's going to affect you. It's a big suggestion. Get ready as I make that sound. And now you're at this other side. You do it as quickly as that, okay? Now you're at the other side, just drifting in a space of bliss. And here I'm going to spike the emotion. Think about the people you love. See their faces. Feel that love. You can describe that how you want. See those faces. Feel that love. I say feel it like a burning hot sun in the summer sky. Shrink it down to a white hot nuclear powered ball of light as big as a golf ball. Pull it into the very center of your being. Feel that light and that love flooding your body and your mind. And notice as you feel that love, how every ounce of that pain's dissipated from your body. Now I want you to, imagine drifting across the other side of the room so you can see yourself in that chair. We'll get into why we do this in a moment. See yourself in that chair. You can see the closure where you can hear my voice. And notice as you watch yourself from the other side of the room, how every ounce of that useless pain has gone from your body and your mind. You cannot feel it, you cannot experience it. And only as quickly as your unconscious, your instinctive part of your brain has made those changes at a molecular cellular level, a neurological level that will allow you that freedom forever. Only then when you drift back over to your body, drop down into your body in that chair, only then will your eyes open and you, with a smile on your face, unable to experience any of that useless pain. Go ahead, take your time, do it thoroughly. I'll repeat those words, only as quickly as. It's a double bind suggestion. Only as quickly as those changes have taken place, only then will you be able to drift back over to your body, drop down into your body in that chair. Only then will your eyes open and you, with a smile on your face, unable to experience any of that useless pain. Now, we're doing this in a group here with 90 people. If you're doing this with an individual client or patient, the moment they open their eyes, not 3 seconds later, 10 seconds later, the moment they open your eyes, you look at them and say, where's the pain gone now? Try and feel it and find you cannot. On a scale of 1 to 10, where's the pain gone now? And notice the difference between how we're asking this question at the end to when we ask it at the beginning. At the beginning, we're saying, how bad is that pain? On a scale of 1 to 10, how bad is it? When we ask them afterwards, when they open their eyes, we say those words. On a scale of 1 to 10, where's the pain gone now? Try and find it and find you cannot. And you're going to get a response that most of you got there, which is, I can't feel it. And then I will say these words, it will never bother you again. And I fully expect it never to bother them again. It takes much longer to describe how to do this than it does to do it. And you look back at this recording, you'll see that the actual thing itself takes maybe 3 or 4 minutes. You can do this in any kind of GP situation where you've got 5 or 10 minutes with your client. If you are giving your client max amount of painkillers and it's not touching it, if they are suffering from stress or anxiety and all you're giving them is beta blockers or whatever other medication you're giving them, why would you not say, look, let's try this. Let's do this. All you have to do is use your imagination and see what happens. You know, I never promise anything when it comes to any kind of pain relief or medication, but my attitude is this: what's the worst thing that can happen? The worst thing is you can be as you are now. It's definitely not going to get any worse. So why would you not try it? And the only thing that will stop you doing this is the fear of failure. That's the only thing that will stop you using this with your patients and clients. What if it doesn't work? But that's about you. I have to tell you, that's about you. That is not about your patient. And I heard this the other day, I thought it was great. So the only thing that grows in a comfort zone is complacency. I would suggest to you, you know, and I've been saying this to my students for a long time now. If you want to grow muscle, if you want your muscles to get bigger, because I in the past, I try and build my body, I try and keep it as good as it can be. If you want to put muscle bulk on, if you want to bulk up with your muscles, you have to work that muscle to failure. So instead of doing 20 reps, you do 2 to failure. So the last one, you rip the muscle, it then heals. Scar tissue is what muscle is. And so you work to failure. When I started doing that, it occurred to me, we're the same. If you want to grow as a person, if you want to grow as a practitioner, if you want to grow in any way at all personally, you have to work to failure. As painful as it is, because in that moment of failure is when you grow. And I've been saying to my students now for a long time, we should be actively seeking failure. We should be pushing ourselves to failure and see it as our friend instead of look at it as our ally, instead of something to be fearful of, because we can avoid it, but it's not until we fail that we actually grow. And I'm going to suggest to all of you, have a go at this. If you want to try this with people you love first, instead of in your practice room, but you're going to get results and you're going to realize you're getting results with it. So you have got the words here. I'm trying to think what the time is. We've got 10 minutes. So I'm not sure. I was going to, hopefully I could put you into breakout rooms. But who feels that they could do this with the words in front of them? I'm going to run it again. If someone's up for doing this as an individual, then I can run it again. Is anyone who would like to do it, maybe for anxiety or maybe for a fear that they've got? Just put your hand up, or just say, if you've got some kind of anxiety or fear, we're going to run it again so you can see how you'd run it with fear. No, I can't see any hands going up, so maybe not. Oh, it's Jane. Jane, you're up for this? All right, I'm gonna spotlight you, Jane, so everyone can see if that's all right. You better hear me, but see Jane. Or would you rather not? Would you rather just stay as you are? Okay, I'm gonna do this for you. Okay, we've got you on screen. If you can just turn your sound on as well.
Okay.
Right, okay. You up for doing this?
Why not?
Okay, great. So is it a physical pain or is it an emotional pain? You don't have to say what it is if you don't want to.
Okay, I'm not sure, but okay, it's probably an emotional pain. It's fear of doing this with a client, probably. There you go.
Okay, so as I said, on a scale of 1 to 10, there's 2 things I symptom scale. Imagine doing this with a patient or a client. On a scale of 1 to 10, 10 being like horrific and 0 being no kind of pain, no fear at all. Where are you at the moment?
It's a 5 or a 6.
Okay, because in a moment you won't be able to feel it. I mean, that'd be good, will it not?
I will.
Right, great. Okay, I'm going to do something different with you, just so everyone here can have an experience. Okay, I want you to do this for me, Jane. I want you are you ready to be free of this?
Yes.
I'm going to ask you to use your imagination. Do your best to imagine it, and I'm going to take you into a light state of hypnosis. So you don't have to do it with your patient, because you can do this without hypnosis. But I'm going to do it just to show you how good it feels. Okay. I want you to do this. I want you to place your hand about 3 inches from your face, just above your face. So look up at it. Look up at your hand. Focus on it. In a moment, you're going to feel it moving towards your face. And notice the changing focus of your eyes. As you notice the changing focus of your eyes, close your eyes. That's right, close your eyes. In a moment, that hand's going to touch your face. When it touches your face, it's going to have a bliss anesthesia. Your body and mind relax completely. That's right. Feel yourself just dropping into the most wonderful state of trance. Nothing bothers or affects you. Nothing disturbs you. That's right. Everything I say now becomes your reality. The deeper you go into that wonderful state, the better you're going to feel. Now I want you to do this for me, Jane. I want you to imagine, once again, just drifting up out of your body and leaving your body in that chair. It's a wonderful feeling, is it not? Completely free of all earthly ties. Imagine you're just drifting up, the essence of who you are, that intangible part of your being, the passenger in that human form. Imagine you're drifting higher and higher, like a helium balloon that some young child let go of in the park. And imagine you're drifting up so high that in your mind's eye, you can look down. You might be able to see that beautiful planet Earth below you. See the whites of the clouds, the whites of the mountain tops, the greens of the forest, the blue of the ocean. See that beautiful blue planet. You may even think for a moment about the 7 billion people on that planet, of which you are one. One unique being. Notice how your perspective changes. Totally new understanding of just how incredible you are. In fact, you are the most incredible creation in this known universe. There is nothing else like you. There never has been, there never will be. And notice how your perspective changes. Now, in your mind's eye, see that target below you, like an archery target. See the coloured band, see the very centre, the bullseye. In the centre of that bullseye is every ounce of the useless, unnecessary, irrational fear and anxiety you had about working with people with this technique. And in a moment, I'm going to make this sound. As I make that sound, you're going to be fired, shot like an arrow, straight through the center of that target and straight out the other side in a millisecond, Jane. But I want you to be brave about this, because as you go through the center of that target, you may experience that irrational fear and anxiety even more intensely for a split second, a millisecond. Be brave. This is the last time it's ever going to affect you. So get ready. As I make that sound, you'll be fired, shot like an arrow, straight through the center of that target, straight out the other side. That's right. Feel yourself just in that wonderful state there. Get ready. And now you're out the other side, just drifting in that wonderful space. Think about the people you love. Think about all the people you've helped through your life, with your understanding, your skill, your care. And see that army of people that are now better off because of you. Feel that emotion, feel that love right now. As you feel that love, notice every ounce of that fear has gone from your body and your mind. Now drift across the other side of your room so you can see yourself in that chair. You can see the clothes you're wearing, you can hear my voice. And notice as you watch yourself on the other side of the room, how every ounce of that irrational fear and anxiety has gone from your body and your mind. You cannot experience it, you cannot feel it. I'd like you, Jane's unconscious mind, to make those changes now at a molecular, cellular, neurological level that will allow that freedom to do this work and help thousands and thousands more people. And only as quickly as those changes have taken place, it will allow that freedom forever. Only then will you drift back over to your body, drop down into your body in that chair. Only then will that arm drift down and you drift back up with a smile on your face, feeling absolutely incredible, unable to experience any of that fear. Go ahead, take your time, do it thoroughly, while I'll wait quietly for your return. That's right, only as quick as those changes have taken place that will allow Jane that freedom, that courage, that fearlessness forever. Go ahead, take your time, do it thoroughly. Okay, look at me. On a scale of 1 to 10, where's that fear gone now? Try and find it, find you cannot. Imagine you're working with someone using this technique. Try and find that fear now and find you cannot. Scale of 1 to 10, where's it gone now? No, you can't find it. I know, it's ridiculous. Try, I want you to really imagine it. Try and find it. No. Of course you can do this. Of course you can do it. Think about all the incredible skills you've got. Of course you can use your words. Excellent.
Yeah, thank you. I enjoyed that.
Great. I enjoy working with you. Thanks for doing it.
Thank you.
Right. Excellent. So look, no, this is not complex. If it was, I wouldn't be able to do it. And I wouldn't have been able to develop it because I'm not a complex person. but I know that every one of you watching this can use this. If you feel more comfortable out using it with someone you love first, you know, there's Louise there and her partner, practice on each other. You know, I'd suggest Louise at the same time that he's going to buy you something nice while he's in that wonderful state. Never waste an opportunity like that. But, you know, just take the opportunity and practice it. As I said to my clients, it's not like this is a new potion or a new medication that we don't know what the side effects are. The only side effects from this is that you can feel completely relaxed and feel great. You're feeling great, are you not, Jane? Yeah. You know, how long does it take to relieve someone of an irrational fear? And there are no limits. And this is out now as an app, right? So you can get it on your iPhone, you can get it on your Android phone. I'm not suggesting you do that, but you can get it. It's free, and you can play it, learn it. It's called the Painkiller app. Okay, you can go and find it, and you can suggest it to your patients if you don't want to do this yourself with them. But I suggest you do this yourself with your patients. But what I'm saying is that you can use this, you can do this and help people change their lives. You can do this in minutes. It does not take hours. You don't have to come and do any training with me to use this technique. And what I was going to say is this app has gone all around the world. And there are people who don't have the same limitations as me. And I know this, and this sounds incredible, but there was one person that put psoriasis in the target, and the psoriasis cleared up. And I'm not saying, but I'm saying to you that the power of your mind is immense. Nothing exists outside of your skull except as perception. You're feeling the pain in your knee, but that's not where it's registering. If you were to sever your spinal cord at your neck, you would not feel anything in that knee or any other part of your body below the neck. And yet you could have your leg taken off and not feel any pain. So although our body is giving us warning signs, when it's useless and unnecessary, I believe all we're saying here is you can switch this off. And as I said, your unconscious mind wants you to thrive. So I go, okay, let's do that. Let's just put it out of our mind. And we already have the ability to do this. We all have the ability to do this. We know it. It's just giving your patient, your client, the opportunity to use their own abilities. I actually don't do anything as a therapist. I really don't. I have no healing powers. I have no powers at all. But I do believe that my client does. And all I have to do is get them into the right state of mind to go, okay, let's do it. Let's try this. Let's switch this off and see what happens. So, look, I hope you enjoyed this lecture. I'm going to hand back to Mark and Naveed. And anyone's got any questions, please ask. Switch your mics on and please ask. I will make sure that everybody that's registered today gets the scripts. I would suggest you, because it's free anyway, download the Painkiller app to your phone, listen to it, use it for yourself, but also, if you know, I don't know if you're allowed to do it, but you can refer your clients to it and say, look, there is this Painkiller app out there. It's free, so you don't have to pay for it. It's not like I'm saying go out and spend 10 quid. You can go out and just use this app and learn from it. So by listening to it yourself, you'll learn the actual technique. And I want, this is my kind of legacy, if you want, I want everyone who ever cares for anybody to learn how to use the arrow technique. Because it's words and it's imagination. And what have we got to lose? Except for the pain, as I say, or the anxiety. So it's Painkiller with an R on the end instead of the R. And you'll find it, as I say, if you can get it download to any of your phones. And it is where we're doing the research, because these guys, they're Silicon Valley guys who've developed it, and they're kind of they're entrepreneurs who want to make a difference in the world. That's why this app is free. And so they are getting data from it, because there's a score at the front and there's a score at the end. It's the same thing. So we now know how many people are getting benefit from that app, and it's words and it's imagination. And I think at the moment there's tens of thousands of people who are using it. So anyway, that's the arrow technique. Over the course of these lectures we're going to be showing you how to deal with fibromyalgia, how to deal with chronic fatigue, how to deal with panic attacks, things that we can help people with in conversation in a 5-minute, 10-minute GP appointment, okay? So if anyone's got any questions you want to ask myself or Dr. Naveed or Dr. Mark Chambers, please ask. You can switch your mics on and speak to me if you want. That's I can unmute you.
Freddie, can you spotlight Naveed and Mark, please?
Yeah.
And then they can talk.
Okay, you're on. You're on, Naveed, if you want to say something. Anyone's got any questions?
Naveed, there's quite a few questions in the chat box as to what the technique can be used for. I wondered if you could just cover off a couple of those, please.
So I've been answering the questions as they've been coming in. I think I've managed to get through most of them. I think as Freddie has already demonstrated that you could pretty much use this for any problem that is presented to you. In a situation where a patient has gone to a doctor, they've been diagnosed, they're on treatment, and it's not working, this technique is fantastic for anything like that. And I would encourage you all just to dive in there and just try it. And like Freddie's already said, there's nothing to lose. It's literally words. You can't hurt your patient. There are no side effects. And all you can do is make that person's life better. So that's all I need to say about this is, you know, don't have that fear of failure. Just jump in there and just try it and see what happens.
Someone's just asked the questions, can it be used with Parkinson's? As I said, I'm not a medical person, so I don't have the same limitations or the same kind of restrictions that a doctor will have. So if someone said to me, and I've had this happen, so this is the truth, it's not me making stuff up. I had a lady come to see me, she saw me at first for a fear of traveling, and she overcame that. And about 10 years later, she wanted to lose some weight, but by then she developed Parkinson's. So she had a very, very strong tremor in one of her hands. I think it was the right hand. So she had this very strong tremor in her hand. And so I did a simple technique, which is we call a finger lock. And if you're going to join us over the next few weeks, I'll demonstrate what that is. And I just said, in a moment, I'm going to touch your hand and that tremor can go. I don't even know why I said it, because it's a ridiculous thing to say. And I touched her hand's come unstuck and the tremor had gone. And then I saw her 2 weeks later and she said she'd been to a doctor and the doctor had said, "Oh, no, it's your tremors gone." She went, "Well, yeah." And I said, "Did you tell him where it happened?" She said, "No, I forgot." And that's how it should be. Because, and I don't know, I'm not a medical person, so I have no idea why that could possibly occur. But I would suggest that without promising anyone, why would you not just suggest that something might happen? You might experience something here. And as I say, I know I don't have the same restrictions as the doctors here have. So I'm more likely to say things to try stuff rather than just not. So, but that's the answer to that question there. I would suggest it. It's words, it's imagination. If nothing happens, nothing happens. But what if? Yeah, anyone got any more questions you can ask? Switch your mics on if you want.
I've got a question. Is it all right to ask?
Claire, yeah.
Yes. Can it be used for slimmers? I asked this question because there's such a big epidemic of obesity out there. And I know that in the clinic where I used to work, we started off with saying a BMI of 35 was overweight, and then it was becoming more normal to have one of 40, 45 or 50. And I was wondering if this might help, because a lot of slimming is a psychological driven thing.
Well, I obviously work with people with weight loss, and there are other things that I work with. For the arrow technique, my attitude, the arrow technique, is that why would you not try it? You know, if their problem's snacking, if they say, because with people with weight, it's normally 2 or 3 different categories. There's grazers, people who just eat all day long. There are people who don't have a stop button. And we do in our culture, and if you're in England, it is our culture to eat everything that's put in front of us, unfortunately. Or even told as kids, you know, your father worked really hard. In my day, it was Biafra. There are kids that are starving in Biafra, eat it up, you know. So we're told that we've got to finish everything. So we grow up with that understanding. And so if that's a problem, you can deal with it in different ways. And most of that is habitual behavior, which we're going to be talking about in some of these different lectures, how we deal with habits. And that includes cocaine, cannabis, and overeating. Because for me, they're all habitual behaviors, and it's just programming. And we have the psychological tools to deal with those things. But if someone comes in and says, I've just got a sweet tooth, can't stop eating chocolate, then I would suggest you've only got 5 minutes, run the arrow technique and put sweet snacking behavior in the target and eliminate it in the same way as you eliminate chronic pain.
Right.
So I don't really have any kind of limits to what you want to do. As I said, I keep coming back to it. It's words, it's imagination. But what if? So try it. And I have no doubt, Claire, you will get a result. And you can do it in conversation and just say, let's just try this. You've nothing to lose. We're going to be teaching you over the next few weeks how to help your client have complete emotional control. So to go to a neutral emotion. Because most of the times, most of the decisions we make in our life, they're made in an emotional state. And when we're in an emotional state, we're not functioning optimally. We're not making the best decisions if we're angry, if we're upset. And it's the same for eating. How many people eat because they're emotional? How many times have you found yourself looking in the fridge because your kids have upset you, or because you've had a row with your partner, and you're looking in the fridge because you're emotional? So once you get people back to control, and so when they recognize they're just about to eat emotionally, to be able to go back to neutral emotion, we're going to teach you how to do that over these next few weeks in these lectures. Because I think for me, of all the things I've developed, I call it TPM, Total Perception Management, of all the things I've developed, and that includes the arrow technique, be able to get back to neutral emotion is the most powerful thing we can do as a human being. And it lifts you to a different space. People like the doctors we have here, and some of you are surgeons, Dr. Naveed's a surgeon, they have to train themselves to be in that situation. You can't be emotional. When you're working with someone that, you know, a human being, and for most of us, and me included, I would be emotional in a situation like that. You can't be. So they're trained. But for the general public like ourselves, or a lot of the people here, to be able to go back to neutral and make a decision from neutral, where you can make the right decision, take the right action, get the right outcome for yourself. So those are the things we're going to be teaching you in conversation with your client, showing them how they can get emotional control. And I imagine a lot of your patients could benefit by that.
Hello, and I just say, obviously I work in a pharmacy as a pharmacy assistant, and we had someone in today who had been given tablets off the doctor for depression. And obviously the gentleman was in and he was telling me the story, how depressed he was, and he didn't really have a family that he could talk to. And amazing, because obviously I'm behind the counter, and I spoke to him and I told him about Joe Dispenza, watching some of his stuff as well, and Tony Robbins motivating things. And by the time he left the shop, because obviously the antidepressants take a few weeks to actually kick in, he felt so much better. And I told him they could come into the shop and speak to myself, and watch his videos and motivate himself. And I think things like that as well, just getting the backup from other people makes a big difference.
You know, it's important, as Dr. Naveed said earlier, about our language and the power of a negative command. And we do it all the time. We do it to ourselves, but we also do it to our clients and our patients. We don't know what we're doing. Let me explain what I mean by this quickly. In the universe, things exist. Only in language do things not exist. It only makes sense for me to say there's not a cat sitting on your desk. For me to say there's not something sitting there only makes sense in language, doesn't make sense in the other form. The unconscious instinctive part of your brain exists, this is my theory again, for two reasons. It wants you to be happy, it wants you to be well, it wants you to thrive. It'll do everything to make that happen. But it is ancient. It's pretty much the same as it was like 4 million years ago. The higher part of our brain, the neocortex, the frontal lobe, that's only developed in humankind over the last 150 to 200,000 years. So in the whole 85 million years of our evolution, we've only had that part of our brain for a very small period of time. But that's the part of our brain that has the Broca's area, that has the ability to speak and communicate in language. But because negatives only exist in language, and because your unconscious instinctive mind was around before language existed, it cannot process a negative. So if I say to you, you don't think about the person you love, what happens? Or don't see that person smile, what happens? You immediately see it because you cannot not think about it. But most of us going through our lives saying, I don't want to feel ill, I don't want to be ill, and I don't want to be unhappy. And in Claire's clients' cases, I don't want to put any more weight. And so the moment you say, I don't want to put any more weight, you have to picture yourself with more weight on. Your unconscious instinctive mind cannot process a negative, but it will get for you everything you're focused on. If what you're focused on is what you don't want, that's what you're going to get. And I think for all of us as therapists or doctors, when we hear our clients saying, I don't want to be ill, I don't want to do this and I don't want to do that, the first thing we should try and do in a subtle way is get them to start to say what they do want. Instead of saying, I don't want to be ill, say, I want to be well. I want to be fit and well. Instead of saying, I don't want to put any more weight, say, I want to be 10 stone. Because in the same way, the moment you say what you want, you have to picture yourself achieving it. And as I said, your unconscious mind wants you to thrive, but it needs an absolute clear direction and it cannot process the negative. And it's the same when we speak to our clients. We want to make sure that we're speaking to them in that way. We say it to our kids all the time. Don't be naughty. Don't play out in the street. We look out the window and think, fine little sod. What you should say is stay in the garden. Be kind. Be good. It's instinctive to initially say, don't do this and don't do that. But that don't part of that sentence does not register. And when you're speaking to your patients and your clients, you have to remember that. So we all need to make sure that our language is positive. And we need to get our clients to start saying the same things to themselves. I want to be 10 stone as opposed to I don't want to put any more weight. I want to be fit and well as opposed to I don't want to be ill. I want to be happy as opposed to I don't want to be depressed. It's important that we get our clients to start using their language in a different way. And it's just about education.
Yeah, just to add that, I'd say that you can't not think about what you don't want to think about without thinking about it if you think about it.
You're exactly right. I have no idea what you said, but you're exactly right, I'm sure.
The thing that irritated me was the little scratch thing. I think it used to get my goat. It was people, my colleagues telling patients not to worry. You know, they don't worry. You know, so I never thought I should be worried about this. You know,
yeah, I mean, one of the things that I think is one of the worst things ever, and I don't know how many people have died because of it, are those motorway signs where don't drive while you're tired.
Yeah.
Now, while you're feeling tired, don't drive. You know, you weren't feeling tired until you read that. Or don't fall asleep on the motorway. Why? You're going to fall asleep on the motorway. I know how many people have died because of that one simple sign. So you've just got to be aware of how important it is. And as I said, keep your language positive, and not just for your clients, but for ourselves. Now I've said it, you will hear yourself saying it. I don't want to feel like this anymore. Yeah. Immediately change that to how you do want to feel, and you will change your life.
But again, you can use this inability the unconscious mind has with processing negative constructively as well. So, you know, for example, people who are having sleep issues, you can give them a mantra when they're lying at bed at night, say to themselves, don't sleep, try to stay awake. You know, because yeah. Doesn't hear the don't, it just hears the sleep, and try again implies failure. You know, I tried to catch the bus means I missed the bus. So don't sleep, try to stay awake. People are kept awake by only two things. One is physical discomfort, needing to pee or pain, etc., or their mind rattling away talking to them. So if you give the mind a job to do, you know, a mantra, don't sleep, try to stay awake, don't sleep, and say it with a sleepy voice, you know, that's a really effective way of helping people to control this chatter that's keeping them awake.
Well, you can use it. You can use it.
The ability not to process a negative in a constructive way.
But you can use it in a positive way. Don't think how good it's going to feel when you're through this crisis. Don't think how good it's going to feel when you're over this depression, because they're going to have to think about it. Don't think how good it's going to feel when you're well and feeling well again. They have to picture themselves doing it. We can use it if we know how to use a negative command, we can use it in that way. But you have to understand how to use a negative command. But I would suggest to all of you, especially if you're going to be working with people, and I know some of you are giving vaccines or working with injections, I would just ask you to do this, just see what the difference is in saying, you know, who brought you here today? Who are the most important people in your life? Who do you love? You got grandkids or whatever it might be. And as you say that, when they access that emotion, you don't have to say any more than that. Who's the most important people in your life? Who do you love? When they access that emotion, just say, well, nothing that happens here is going to bother or affect you or disturb you. And then give them the injection and they won't even feel it. I promise you that it's going to happen. Just try it. You've nothing to lose. It's a big difference saying nothing that happens here is going to bother or affect you or disturb you, as opposed to you're going to feel a sharp scratch. You know, there's a big difference in your language in that respect.
Some of you may remember a good 20 years ago, there was a big campaign, don't do drugs.
Yeah, look at where we are now.
How many of you remember that? And we were in the biggest drug crisis at the time.
Yeah, I mean, but you know, it's just not understanding the power of a negative command. And as I said, most of us are using those negative commands on ourselves all the time. I don't want to be depressed. I don't want to be anxious. I don't want to feel bad. I don't want to put on weight. I don't want to be unhappy. And the worst one is I don't want to be ill. The power of our mind is immense, but it needs a clear direction.
Well, I just want to say a big thank you to Mark and Freddie, and for all of you who've joined us this evening. It's been absolutely amazing. I'm just a little bit conscious of time. We have overrun. I'm going to leave you all with one challenge. Try and see if you fail. Try and see if this doesn't work, and you'll be pleasantly surprised. And when we come back for the next seminar next month, I want you all to come back with one story of how this has worked for you. Can we do that? Excellent.
The hardest part of this, using this technique, and you're going to have to practice this, is not to look too amazed when they say the pain is gone. Don't go, really? Act as if you're doing this every single day of your life. Act as if it's going to happen, and try not to look too amazed when they say, I can't feel it.
Expect it to work.
Yeah, and be prepared to be surprised.
Yeah.
Just looking ahead, the next session will be hopefully the Thursday, the 4th of February, and what we've discussed so far will be to be looking at chronic fatigue in that section, which probably we haven't discussed it amongst ourselves in detail yet, but that'll probably include things like fibromyalgia as well, possibly. Or do you want to do that as a separate session, Freddie?
No, what chronic fatigue and fibromyalgia?
Yeah,
we can do it together if you want. Yeah, there are two things that
I think
we don't have an answer. Medics don't really have an answer to other than medication, and we know that we can help people without medication on both those issues, and you will be able to as well.
So what we'll do is we'll send out to everyone a agenda, a rolling plan for the next few months, the topics that we're going to be covering, and along with the script from today, so you can all start practicing straight away. How does that sound?
And we'd really appreciate feedback as well. So any feedback, we've got it in the chat box, but I've left my phone number and my email address there. So if people want to contact me, and they can contact Amanda. Yeah, we want feedback and suggestions and etc. You know, just make these your sessions. You know, we're happy to provide the content, but the more suggestions we get from the participants, the more take ownership of this.
I know a lot of you are incredibly busy, but if you want to come and fancy doing some training with me, it's the Jacqueline Hypnosis Academy. You can join us. You can have a 14-day free kind of trial. You'll see everything I've done over the last 30 years. You can come. We're starting a diploma course, which is a 50-hour course on the 13th, I think, of this month. And if you kind of join now, it's free. You get that first 4 hours of that as well to see if it's something you'd love to do. But I honestly believe you'll get some benefit in those 14 days. So Jacqueline Hypnosis Academy, if you want to come and join up with me, do some training with me and my son Anthony. It'd be great to see you there.
Excellent.
Well,
Good.
thank you very much,
Right.
everyone.
Thanks everyone for joining. Hope you've enjoyed it, and enjoy being free of the pain. I know that you can do that now. Okay. Be fearless.